much. We move on to the last speaker. We have Dr. Maneesh Singh, who will be talking about the tips to use mitomycin C in Trab.
Thank you, Dr. Rajesh and Dr.
After
Ajay.
this, we'll have a quick photo. So please stay back for just one more minute.
Thank you for the opportunity. Since we are already running late, I'll just give 4 very basic tips for use of mitomycin. First, very important thing, when you're seeing the patient deciding for surgery, on your OPD sheet and case sheet, you should mention what is the dose of mito you should be used and not decide on table based on the etiology of screen off. Oh, sorry. Okay. So based on the thickness of tenon, based on the target intraocular pressure, the age of the patient, the etiology of glaucoma, you should decide whether you can use a 0.2 or a 0.4 and what should be the duration of mitomycin. So on US glaucoma, you'll probably using a 0.4 for 3 minutes, and normal primary opening or angular glaucoma, a 0.2 for 1 minute or 2 minutes will be sufficient. While using mitomycin, the concept which has been popularized by Dr. Pankhaw that we should spread the use of mitomycin posteriorly over a large area to get a large avascular bleb, and not a localized application of mitomycin which gives you more avascular blebs, and avoid the edges of the conjunctiva to reduce the chances of leakage. This was a patient who was referred to us for bleb needling, but on table we realized there was some unusual swelling here, and when we explored it, we found there was a retained sponge. So now we have made a rule in our OPD OT. Always we cut 6 sponges, and every time at the end of the surgery we make sure that 6 sponges have been removed, because sometimes a small sponge or a half cut sponge may stay inside and can lead to infection and granuloma formation. Again, there's been a trend to use a lot of mitomycin injection. The advantage here is that the dose is more predictable. You can use a 10 to 20 micron. The same 0.4 milligram per ml can be mixed with 0.1 ml of lignocaine to give you a 20 microgram, or a 0.1 ml of 4 milligram per ml can be mixed with 0.3 lignocaine to give you a 0.10 microgram. This can be used, but overall studies have shown that the results are similar. So whether you're using an injection or sponge, till now most data have showing a comparative data. Thank you.
Thank you, Dr. Manish, for very crisp and some very important points that we should remember while using